Hello again. I'm Judy Sedgman. Welcome to another edition of Innate Health, Eliminating Stress and Creating Healthier Communities. Today, I'm very fortunate to have as a guest a longtime colleague of mine, one of the most interesting and dynamic psychiatrists that I've ever known, and a gentleman who can explain innate health and the principles behind it with great clarity and wit. So I'm going to welcome my guest, Dr. William Pettit, and today our topic is going to be primarily PTSD. This is such an important topic at this time when we have so many returning veterans, when we have so many people traumatized by various things that are going on in our society right now across the world. And PTSD is a problem that has bedeviled the mental health field. I'd have to say that in the literature that we've read, it's really difficult to feel hopeful about an answer. However, Dr. Pettit is very hopeful. And one of the things that I'm going to ask you to do as you listen to him, because I had to learn this early on as I listened to him, is that he challenges a lot of ideas that you may take for granted, that we've gotten used to in life, that we kind of, we've heard so many times we think they must be the way it is. And I find in listening to someone who does that, to just listen with an open mind, knowing you can always go back to what you thought before, but give it a chance. And so with that, I'd like to welcome you, Bill.
Well, thank you, Judy. It's really a pleasure to be back here in Bradenton area where I was many years ago, 26 years ago.
Yeah, that's where we met.
Yeah.
So I'd like to start out by just asking you, what is the traditional definition of PTSD? What's the definition that we're all working on right now?
Right. I actually brought my DSM-4 because I wanted to get the wording at least at the beginning, and I'm certainly not going to read all of the criteria, but I'm going to read the kind of the core thing of it. And post-traumatic stress disorder, the person has to have been exposed to a traumatic event in which both of the following were present. Both. The person experienced, witnessed, or was confronted with an event or events that involved actual or threatened death or serious injury, or a threat to the physical integrity of themselves or someone else that they were close to. They have to be actually exposed to that. And the person's response had to involve intense fear, helplessness, or horror. And so not just the exposure to the incident, but they have to have also had in their experience, which we'll talk about where that comes from later, has to involve intense fear, helplessness, or horror. In children, this may be expressed by disorganized or agitated behavior.
Yeah.
But subsequent to that, it has to last at least for a month to be post-traumatic stress disorder. And it has to have symptoms of the following things. It has to, at least there has to be, the event has to be re-experienced frequently. This can be through nightmares, it can be through daytime flashbacks, but it has to be re-experienced. There has to be, because of the intense fear of re-experiencing, the person then has to avoid anything that reminds them of that. So of course many of our veterans that came back from Vietnam could not watch many of the Vietnam War movies that came out after the war. They just couldn't, and they would go away. I thought of, even when I was a child, when we used to go up to Kalamazoo, Michigan to visit my aunt and uncle and their children, the man next door was a World War II veteran. And we often went over the 4th of July weekend. Well, he went to the countryside. He never stayed in town because of the fireworks, because of fearful. So avoiding stimuli that would be associated with it. And the third is that there has to be a persistent, and we'll talk about later a term that you and I had talked about before from research, of allostatic load, that the person has to have a persistent sense of hyperarousal, of vigilance. I had a roommate who was a Vietnam veteran when I was in school, and my roommate, other roommate, made the mistake of doing something suddenly, and he flew out of his bed and had him up against the wall with something,
Wow.
because there's this tremendous startle reaction. So there has to be a hyperarousal state that's manifested with outbursts of anger, difficulty with sleep, different things. So that's the core symptoms. The core symptoms are that there has to be this event that is very threatening. Then there has to be re-experiencing, and then there has to be avoidance, and there has to be a hyper startle response. Yeah.
Now, I'm going to ask you how your definition would sort of flow into that diagnosis, but I thought I'd just start out just so people will kind of understand where you're coming from.
Right.
You've treated a lot of people with PTSD over the course of your years in psychiatric practice, I know, and I'm not asking for a number because that would be impossible, but I thought I just wanted to make certain people know that this is a diagnosis that you're very familiar with.
Right.
Yeah.
Well, I have. I was in the Navy for 9 years, and saw, and this was during the Vietnam era, and so I saw, and then through the years in private practice, and then at West Virginia University, I saw people from, World War II, from the Korean War, from and many from Iraq, many people who had this experience from sexual trauma, either as a child being molested or as an adult having traumatic sexual rape or things like that. So yes, I've treated many people from many traumatic situations that experienced these symptoms. Yeah.
So as you've described what's required to provide that diagnosis, when you look at people with PTSD, what is it from the perspective of innate health? And you can ground that however you wish to, but what is it that you see that is different?
Right. Well, it's interesting. The symptoms the criteria are the criteria. I mean, that doesn't change for me at all. What changes for me is the hope that I have that the person can come back, that number one, that there's a place within them that has not been scarred, has not been touched, is inviolate, is that the word?
Inviolate, yes.
Yeah, is whole, that and that can be re-accessed. I as you know, I like Bob Dylan a lot, and Bob Dylan has a one line that says, we can come back, but we can't come back all the way. Well, I think that's that would, when applied, that line when applied to post-traumatic stress disorder would be what the standard is, that you can come back, but you can't come back all the way. And I would say that's just not true, that you can come back all the way, because there is a place of mental well-being within the soul, the heart, the being of a human being that can't be injured, it can't be touched, and that's what gives me hope when I see somebody who's having these symptoms. That they can come back all the way. It's interesting. First of all, it's very interesting, even in the criteria, that both of those things have to be occur. That the person has to have this experience, but then also has to experience this horror and this helplessness, which must mean that not everybody
does.
Not everybody does, right?
Yeah.
I mean, even if people would even look that it can't totally be the outside event,
right?
Because even there's variation, and it's very interesting. I was listening to a program on my monthly thing that I receive that was saying that in the United States, this is not in Cambodia or somewhere where there's been constant war or turmoil. In the United States, 70% of the population has had an event in their life that would qualify for post-traumatic stress disorder.
Wow.
70%.
Wow, that's amazing.
It's amazing, isn't it?
Yeah.
But only the incidence in the United States is about approximately 7% of the people. And now I always forget incidence, prevalence,
Yeah.
incidence?
Well, whatever.
Whatever.
Incidence will do it. Yeah.
About 7%. So,
Yeah.
so that about 1/10 of the people that experience a traumatic event, something that meets this criteria, only about 1/10 of those people experience the persistent symptoms. And it would seem that people would be wondering about that, you know? I mean, and
Yeah.
people have wondered.
Yeah.
They've wondered that even something as traumatic as rape, at 30 days, I saw one say 96% of the people met criteria. But at 90 days, only 46% did. And then later, 36. Well, something's happening there that some people are accessing, are re-accessing something that they're getting back.
Yeah.
And they may not be, all of those may not be getting back all the way, but there's some internal capacity to reach mental well-being that people are accessing to varying degrees. And the hope in the field, even Dr. Shalev from Israel, that is one of the internationally known, and I talked to him over the phone a couple of times. He's always said, "Well, come visit me," and I said, "No, you come visit me." You know? But he's much more famous than I. You know, I'm not famous, so I think it's probably the burden for me to visit him. But he in his chapter in the National Post-Traumatic Stress PTSD Handbook, that edited by Dr. Friedman from the National, he said that if anyone ever found principles that allowed people to, he said, obviously there are some people re-accessing something innate. And his question was, if we could ever find a way to do that on a more consistent basis, then it would be tremendous.
Yeah.
You know? And you have said earlier, and if I get rambling too much, stop me. Please do, or get going too fast. I'm passionate about this because I see a lot of people. I see a lot of people in what I think is needless pain.
Yeah.
And innocently, I think that our profession has, and I'm just going to be honest, you know, and say it's just my opinion, innocently have made things more painful for people. Not because they wanted to make them, you know, they wanted to help them, but they've made it harder for people to come back by the things that we've done supposedly as therapy, and I think that's I don't know. I think that's really sad. You know,
Yeah.
I mean, we used to use leeches, and we used to, you know, do all kinds of things that we don't do now. And it's interesting. There's actually some cases where they do leeches, but you don't do it
as the cure-all.
You don't do it as a cure-all. You don't bore a head in somebody's hole. A hole in their head as the cure-all. There's maybe a time to do that to relieve pressure, but we've understood now some of the principles of circulation, of infection, of sepsis that allow us to treat those conditions with much more understanding so that we can be discriminate in what we do. And you know, when I think of the young men and women that are coming back from Iraq and Afghanistan and the physical and emotional experiences that they've had, and throughout the world, you mentioned we have to think of ourselves as a global, you know, as a global community, and the torture that people have done to other people, and all justified in their mind in doing it. But the effect that that's had on them and their families, there has to be more hope than we've had. And,
Yeah.
and so that's what maybe would be good to, I don't know,
Yeah.
talk about. Yeah.
Well, that's to bring it back to that.
Yeah.
I wanted to ask you if obviously we've talked about the fact that some people just seem to be able to reconnect to something and
Right.
gradually get over things.
Right.
And then the people that you see are the people that are stuck in that diagnosis.
Right.
What do you think, if you're starting to talk to someone, what is the most important thing for you to be able to do to get them to reconsider or to reopen their eyes or think again or look at things differently?
Right. That's a really good question. I think the most important thing is to have people start to get a glimpse that of the role of their power that they're using every moment, the power of thought, that what they're doing with their thinking every moment has incredible impact in their experience. And in fact, it's really our experience is coming every moment from via thought. Now, what the traditional, it's interesting, what happens in post-traumatic stress disorder is that something happens that's very, very threatening or very damaging, and I always forget the exact word, whether it's ontologically or whatever, but there's some value in that we want the child that puts his hand accidentally on the burner to remember.
Yes.
That's not a good thing to do.
Right. Yeah.
So that when there is a painful memory, it's encoded in a very powerful way. When there's emotion involved, it's encoded in a very powerful way so that the person could remember that and avoid that if they're able to in the future. So you see that there's some value in having that, but what we haven't taught people was that a memory is a memory. It's a thought. It's not reality. And we have been taking people back into their memories instead of teaching them what a memory is. That it's something that doesn't exist except as a little chemical thing, a chemical electronic thing on their memory thing, a chip on their brain. And it doesn't mean that we have control over every thought that gets triggered, because if I would have walked on this set today and one of the men that were so kind to help us out here, if one of them would have been a spitting image of a very dear friend that had been killed in an accident when I was in college or in medical school, and I would have suddenly had something in the pit of my stomach, and I might have even had some tears coming down my cheeks because those memories had gotten triggered, right?
Right.
And I might have had to say to people, I need 3 or 4 minutes here. I need to just sit quietly. I need to let this reverberate through my limbic system and the special part of the brain that handles emotion, and let it come through my senses. And I know that if I just stay quiet, that it's like a life vest. So one of our patients said, I realize this life vest is there, and if I just get quiet, it'll take me back to the surface.
Yeah.
And I would have known that. But if people aren't taught that, they're terrified by their memories, and they fight them, and they innocently, in fighting them, feed them. I know you've heard me say that really upsetting thoughts are a lot like relatives that come to visit. Right? If you don't feed them, they don't stay very long, and we feed them innocently. So that I think that one of the biggest things is to teach people that there is that there is this capacity to regain mental well-being, that it's very real, and that it hasn't been touched by anything, and two, that their experience of thought is fluid. You know, you're wonderful at teaching this, as I've taught with you through the years, that it is like a river. I mean, supposedly we think 60 to 100,000 thoughts a day.
Yeah.
And I haven't heard anybody that can tell me their last 10. Right?
That's true.
Right? I couldn't tell you my last 5.
Right.
So it's fluid, and the only thing that stops that fluid flow of thought is when we get frightened by them, or we get reactive to them. And to me, there are these principles that I was exposed to back in 1983. Is it okay then to talk about those?
Absolutely.
And you know, talk about it in a short time like this. You and I have both done 4-day seminars on this. So, but that there are 3 powers, if you will, 3 universal principles that we're all using every moment to create our experience. The mind is not, I mean, at least these are the assumptions that I operate from, and I'm not asking everybody that they have to believe them, but this is what gives me hope, I guess is what I would say. That mind is spiritual, mind is formless. I mean, that's what I mean by spiritual, not something airy-fairy. I mean that it's formless.
It's an energy.
It's an energy. And mind is an energy, and I'll be frank, to me, mind is whatever intelligent energy there was even back before the Big Bang. There was something, before there was all this form, there was some intelligent energy. And that, to me, everything, ourselves included, are manifestations of that energy in some degree. I mean, this table looks real solid, this, but we're told by the physicists, and I believe them, that there's atoms in here, and then inside their atoms, there's electrons going, 3/4 the speed of light or something like that. And I don't know, I haven't seen it, but I believe that energy, this whole show is energy, this whole experience of life is energy, and that we're using that energy to go through life, and it manifests by the power of thought, that every human being is thinking every moment. And you hear people say, well, I want to stop my thinking. Well, lots of luck. You know, you can't do it.
Right.
We're thinking beings.
Yes.
But whatever we think then is like our consciousness, the third gift, so there's mind, triggers this experience of thought, and then we're conscious of whatever we think as our reality.
Yeah.
And so every single human being is walking around with these 3 elements, mind, thought, and consciousness, making different compounds all day long, right? And all of us, I think, have usually noticed, whether if we've been married or been in a relationship with anybody, that we don't all make the same compounds. So that we're not always seeing the same thing. At least my wife and I, on rare occasions, see things slightly differently, right? What's true is everybody is.
Sure.
And so the hope is that if people just start to have the experience, get a glimpse that that's what's happening. I mean, I remember, and I won't go into detail here, but I remember one person who had a traumatic event, and it was very traumatic at the time, and she had many, many, many hospitalizations. And I said to her, you know, whatever it is that happened, it's over. It's over. And she at first became very angry with me, and she said, you don't know anything about what I experienced. And she went on for more than just a few seconds, and I said, that's true. And what I said is true also, that it's over. And and I know what you want, I said. And she said, you don't even know me.
Yeah.
I said, I know what you want. She said, what do I? I said, you want to be at peace.
Yeah.
I said, I've been a physician for over 40 years, and I've never met a person yet that doesn't want to be at peace.
Right.
And the only thing that's keeping you from peace is the lack of understanding about how your mind works, so that you innocently, and underlined 100 times,
Yeah.
innocently are using this gift of thought in a way that's causing pain for yourself. And as she got a glimpse of that, this woman that had been hospitalized 23 times, found peace. And again, she's not the only one. I've seen that so many times. I saw a man, Ken, is okay,
Certainly.
a few months ago, and he was in his 60s, and he had learning difficulties in school, so the IQ was not real high. He was a very, very heartfelt man, and I felt for him. And he had been sexually abused by a grandfather for many years as a child, and he had carried this through life, and it manifested in anger outbursts towards his family and everybody. And he ended up, he was going to take his life, and he ended up in the hospital. And I remember, without going into detail, but basically, I remember when he had that moment of insight, and he sat back and he said, he got this big grin that kind of almost went from here to here. And he said, "You're right. It's over, isn't it?
Wow.
It's over."
Yeah.
And then he sat forward and he said, "Dr. Pettit," he said, "I see that for the last 45 years, I've created incredible pain for myself." And he said, "What saddens me is that I see that I've then inflicted pain on other people by the way I was, but I also see that I didn't know any better. Mm-hmm. I didn't know any better." And he just had tears of gratitude, when I know that moment, the potential for that moment to happen is always there with every single human being that comes before to sit with me and thinks that's what's happened in their past precludes them ever being at peace.
Yeah.
And that's what makes it exciting.
Do you feel confident that more and more people are going to come around to seeing that this is the reason I asked this question to back up is that I do a volunteer group with women who have had a lot of trauma. Many of them have had trauma because they're married to people with PTSD who act out.
Right.
And when I talk to them about these principles and about this hope, the first thing they all say is, but my husband's in treatment, and they're making him go over it and over it and over it.
Right.
And he comes back from these groups, and he's, one woman told me, "I just don't go home the night that he goes to group."
Right.
And I know that's what you referred to earlier when you said it kind of saddens you to see that we innocently do that.
Right.
But what do you think it'll take to awaken people to the fact that there's a different way to go about this?
Yeah. It's really it's interesting, because whatever I've attempted to do for the last 28 years, it wasn't that. It takes more than what not just me. I mean, a lot of other practitioners that have tried to go to people at very, we won't go through the list, but at pretty high levels, and said, "Just give us a chance. Just give me 3 weeks with 30 soldiers, and let somebody else do the traditional with those same 30 and nobody's ever, they said, well, we need you need pilot studies, and we've tried, and I have to take, I'm not a researcher, I'm a clinician, and we've tried, and so I don't know, I don't know. I think there is some encouraging signs that people are starting to, Dr. Seligman's work on positive psychology, Barbara Fredrickson's work on that seeing that people in a positive feeling state access a deeper intelligence that we would
Yes.
call wisdom,
Right.
that we would call this connection to this universal intelligent energy, that there are people that are seeing that mindfulness, the mindfulness is an attempt to try to detach people from their content of their
From the
thinking.
intensity of it, yeah.
So there's a direction, but there's still, I mean, even this month in my journals is big review articles on re-experiencing. And so people might say to me, they say, Dr. Pettit, there are a certain number of people that get some relief from doing this, from being forced to go through. What is your answer to that? Well, is it okay if I give it a
Sure.
shot? First of all, before I would do that, my response to people, when people come in and they say they've got this issues from this past, that they've been told they've got to deal with it in order to be at peace. And I say to them, to me, the opposite is true. That I'm going to invite you to be reminded of some things that you knew but you forgot. And I'm going to put that, what you forgot, in terms of three principles that will allow you to access a place of peace. And once you've, almost like a vertical shift, once you've gotten some distance, like a helicopter, once you've gotten some distance in a state of peace, you will look back at this, quote, traumatic experience, and it won't have the power anymore. You'll see it as something that doesn't exist anymore except as a thought. But you can't see it when you're at the same level of it. And Einstein, as you and I know, love Einstein's wisdom. He said to summarize what he said, the solutions to problems will never be seen at the same level of thinking and understanding that they were created, right? And to some degree, the fact that this person is one of the 10 people that had a traumatic experience that is caught in this, there's a level of understanding that talking to them in that state of understanding makes as much sense as somebody trying to defuse a bomb without going to bomb defusing school.
Yeah.
And nobody would do that.
Right.
Right? Nobody would do that, So I tell my patients, they come in and they want to talk about this. I said, have you done that before? And they said, well, yeah. And I said, how's it been working? They said, well, it hasn't. I get suicidal. I start drinking more. I start using drugs because it becomes so painful. And I said, well, I'm going to take you to bomb defusing school, and then we'll take a look at this. If you'll know when the time's right. Well, that's totally different.
Yeah.
That's totally different. If I can intersperse, I have a friend that always says, that calls me, Bill, do you have time for a story? So I won't tell the story, but I was in the airport one time, and I saw this fellow, because I used that metaphor of I saw this fellow that had a T-shirt, and on the back of it says, I'm a bomb diffuser. So if you see me running, it would be a good idea to run after me. Anyway, I just thought of that.
That's a great T-shirt.
But I think the idea being that we have what we've done traditionally, and so people say, well, that's what we're doing. I mean, I was one time where this psychologist, God love her, and this is probably politically incorrect, but she got a $2.5 million grant to make a simulator to put people in that had limbs blown off while riding a Humvee in Baghdad, streets of Baghdad, that totally simulated the streets of Baghdad, so they could get back in their Humvee and I'm going, I could have put that $2.3 million to a lot better use, I believe, in helping people get free from their pain.
That's really true, and it reminds me. Unfortunately, we're running low on time, but it does remind me of our late friend and the person, the philosophical provider of these principles that we talk about, who discovered them and saw them and explained them, Sidney Banks, and I happen to have his book here, The Missing Link. But I remember the first time I met Sid, he said, you know, taking people back into their trauma is sort of like when your child gets out of the bathtub and you say, let me dry you off, and you put them right back in.
Yes.
And, you know, you'll never be dry.
Right. Do I have a 90 seconds or 60?
Yes,
or not?
yes, indeed.
Just, if and I didn't mean to interrupt you.
No,
I'm
no,
sorry.
not at all.
Just that Mr. Banks, and I was remiss, I mean, because Sidney Banks in 1983, when I was exposed to that, and I tell people, prior to that, I was not a mental health professional. I was a mental illness professional. I don't remember ever having a lecture in 26 and a half years of schooling on mental health.
Right. Yeah.
But I had all these degrees that said I was a mental health professional.
Yeah.
And I knew nothing. I didn't myself. I spent 5 to 9 hours a day in worry, guilt, resentment, upset, overanalysis, unresolved grief, and then wondering why I went in and out of clinical depression. But nobody before Mr. Banks had ever told me that thinking was something that I was doing.
Yeah.
It wasn't being done to me.
Yeah.
Things weren't eating on me. I was chewing on them.
Yeah.
And people have said, wasn't that disheartening when you realized that your stress was coming from you? And I said, are you kidding me? It's the most exciting day in my life, because the things that I attributed to my stressed out, depressed feeling were all external to me, and I had no control over them.
Right.
If it was coming from me, there was at least a chance that I might get to see something that would allow me to stop doing it so badly to myself.
That's so true.
And the metaphor that I use, we spent time at West Virginia University, that where very sadly occasionally there's mind cave-ins. I'd say that, you know, it doesn't take very many photons of light to give hope to a miner who's in a cave-in.
Yeah.
Because if there's a little bit of light coming in, there's a good chance I'm going to get out.
Right.
And when I met Mr. Banks, a whole bunch of photons of light came in that I wasn't not going to have to live till the day I died fighting stress, regardless of what's happened in my life.
Well, Bill, this is a beautiful place to end, and I can't thank you enough. I loved your clarity and your passion for this work, and just to let our audience know, Bill is one of the greatest contributors to the spread of this understanding, especially among medical professionals. And it's a real honor that we've had him with us, and we're going to have to end this segment, but we have one more chance to talk with Dr. Pettit next time. So thanks very much for being with us.